Dr. Rob Cywes. Sugar immediately inflames your blood vessels and the cells lining the liver.
There is a global trigger of inflammation. If you're a mammal, if you're a human, it causes it in all mammals and certainly in all humans. And because TPN, total parenteral nutrition, intravenous nutrition, was created in the 1970s, in the high days of believing that carbohydrates were so necessary in our diet. As we created TPN, the mindset was that the dominant source of energy for the human body, but usually 25% concentration of dextrose in TPN, there were two very important things that we did. Number one, when you go up, you have to go up slowly and you have to come down slowly because people can get hyperglycemic when you give it too quickly and hypoglycemic if you stop it right away. Their blood sugar drops too low. Because almost always when you give TPN with 25% dextrose, you have to add in insulin. Why? Because you made them into an insulin-dependent diabetic by infusing that amount of sugar. One of the other things that we have to do when we put people on TPN, we have to put a long IV in that goes almost to the heart, to the big vessels, because that concentration of sugar in a small peripheral blood vessel, in a small vein, will irritate the lining of that vein so intensely that it'll form blood clots and that it'll cause inflammation and that vein will clot off. And even a 10% dextrose infusion can clot that vein. At a microscopic level, what's happening is the sugar, the cells that line the blood vessels are called endothelial cells, and they should be nice and flat and inert. They should have a very nice smooth lining on top of them, completely inert. And blood should just flow by nice and happily. La-di-da-di-da. But what happens is when you put sugar in, the sugar very quickly gets into those endothelial cells and it activates them. They round up and they bulge into the lumen, so they narrow the lumen. They also start exposing little parts of the underlying basement membrane, the underlying structure of the vessel wall, not protected by these nice smooth cells. And those places are procoagulant. They form little blood clots. The clotting factor comes in, clots form, platelets get in there, platelets get activated. That's my PhD. And then it attracts lymphocytes and you form this blood clot that clots the blood vessels. We've learned to run that TPN into the big blood vessels where the vessels are very wide. There's huge amounts of flow. So there's all this dilution. And the concentration isn't quite enough to cause that kind of damage, at least obviously, because we know that that damage does occur, but not as obviously as in the peripheral veins. I'm just using that as a very simplistic example of vascular inflammation caused by the direct infusion of sugar into those blood vessels. Now, here's an interesting thing, folks. If you measure the concentration of that blood, it's only up a few points. Normal being about 85 milligrams per deciliter is a normal blood sugar, 85 or lower. Where do we every day recreate a milder form of the TPN function? Well, we put in our face quantity and percentage and concentration and frequency, all that sugar and starch that we're eating, and it doesn't matter. And this is important. It doesn't matter if it goes in as an apple or ice cream. It doesn't matter if it goes in as brown rice or white rice. It doesn't matter if it's a baked potato or French fries. It doesn't matter how that sugar gets into our bodies. But the sugar gets taken up our intestine and dumped directly into the portal venous system, goes to the liver. And the first place it causes damage, this is my PhD, is in the liver cells, the sinusoids, the lining cells of the liver. And you get inflammation of the liver.
Dr. Cywes gives an example of a common global trigger of inflammation in humans. After an operation, you may need a TPN, total parental nutrition, which is intravenous feeding. This was created in the 1970s at the height of carb frenzy. So usually this solution had 25% dextrose. When they're using TPN, they must go up slowly and down slowly to prevent hyperglycemia and hypoglycemia. And they must add insulin. Why? Because it gives the patients temporary diabetes. They have to put in a long IV tube almost to the heart because it has to be in a big blood vessel. If it goes into a small vessel, it would irritate the lining. It would form blood clots, cause inflammation. The small vein would clot off, even at a 10% dextrose concentration. The endothelial cells should be flat, inert, and smooth inside the blood vessel. But sugar quickly gets into these cells. They round up and bulge into the lumen. They expose parts of the underlying membrane. They start forming blood clots, and clotting factor comes in, platelets form and are activated. It attracts lymphocytes, which are white blood cells for fighting disease, and this clots the blood vessel. So that's why they have to use a large blood vessel where TPN concentration would be smaller. Inflammation caused by direct infusion of sugar. If you measure the concentration of that sugar in the blood, it only bumps up the sugar a few points. Normal is 85 milligrams per deciliter or less. Every day, where do we recreate a mild TPN function? It's all the starch and sugar we eat. It doesn't matter if it's an apple or ice cream, if it's brown or white rice, if it's a baked potato or French fries. The sugar gets taken up in the intestines, into the portal venous system, goes directly to the liver. This is where the first damage is caused, in the liver cells, the sinusoidal endothelium, the cells lining the liver. It causes inflammation of the liver. Annotated and summarized. Easy to share with loved ones. The description below the title for this video has these summary points.